Hi guys, this is part 2 of chapter 26, the medicine section. I'm going to finish out our slides, so we'll go ahead and share that now. Sorry, if you can, I don't know what you guys can see and what you can't. Here we go. We're starting with anticoagulant and management. So here we go. All right, so 93792 and 93793, the anticoagulant management codes. Anticoagulants are warfarin and Coumadin. The notes in the subsections are a must read, or I'm sorry, in the subheading are a must read to know how to properly report these codes. We've got outpatient management of warfarin therapy, training for INR monitoring. 93793 is billed once per day, any number of tests reviewed. So now we're moving on to non-vascular diagnostic studies, 93880 through 93998. Vascular codes for procedures on non-coronary veins and arteries, and includes patient care, supervision and interpretation, S&I, copy of results. You should always have a copy of those results. This was also reviewed in chapter 17 of your text. So now we're moving to pulmonary, 94002 through 94799. It's for ventilation management therapies and diagnostic tests. It includes procedure and interpretation of the test results. You need to add an additional E&M service that's reported separately. Ventilator management codes are further divided by place of service. Facility is billed per day and home billed by one time per month. Each test should be reported separately unless otherwise indicated in the code description. So now we're moving into allergy and clinical immunology, 95004 through 95199. Okay, it's divided into 3 subheadings: allergy testing, ingestion challenge testing, and allergen immunotherapy. Allergy testing consists of performance, evaluation, and interpretation of allergens, ingestion challenge test for sensitivity to food, drugs, and other substances, and immunotherapy indicated for patients with allergic rhinitis due to seasonal pollinosis caused by trees, grasses, weeds, etc. You are strongly encouraged to read the notes that appear at the beginning of the allergy and clinical immunology subsection. That's not news. We need to read all of those notes when we're coding, right? They always say that. It's so important to brush up on the rules and regs. So more on allergy testing. 95004 through 95071 is sensitivity testing using various types of tests. For example, percutaneous, intracutaneous, and inhalation. Tests use numerous substances, for example, extracts, venoms, biologics, and foods. Type and number of tests based on physician's judgment. Medical record will indicate the number of tests, type of test, and the method of testing. Ingestion challenge testing. Sensitivity to food, drugs, and other substances. 90576 reports initial 120 minutes testing time. 95079 reports each additional 60 minutes. Services less than 60 minutes you must report in E&M code. So allergen immunotherapy continued. All codes for allergen immunotherapy have specific notes that describe the service. The codes are divided into 3 types of services: injection only, prescription and injection, and provision antigen substance only. Codes 95115 and 95117 are payable in an office setting. Allergen immunotherapy 95115 through 95199. Physician service bundled into immunotherapy code. If separate E&M services provided, report separately with the modifier 25. An office visit code is not usually reported, but when is it reported? When the physician provided another identifiable service at the time of immunotherapy. So we're moving to neurology and neuromuscular procedures, 95782 through 96020. These codes are usually used by neurologists. They contain codes to report tests such as sleep testing. To code sleep tests accurately, the coder must know the parameters, what is being measured during the sleep test, and the stages of testing. In addition to many codes include a time component. They're also going to be testing muscle and range of motion testing, EEGs, neurostimulator procedures, functional brain mapping. There are many bundled services. Services usually provided in addition to an E&M service. These are often consultation services. Oh, sorry, went too far. Let's go back. Okay, Central Nervous System, CNS Assessments test 96105 through 96146. Codes from this section are used for psychological tests, speech language assessments, developmental progress assessments, and thinking and reasoning examinations. These codes are mainly billed on a per-hour basis. The results are put on a report that goes in the patient's record. So now we're moving to hydration, 96360 and 96361. Okay, infusion. What is an infusion? An infusion is the introduction of liquid into the body over a long period of time. Infusion is therapeutic procedure to introduce fluid into the body. I just said that, but I just wanted to say it a little bit differently. Example, fluid into the vein for patient for rehydration. Codes represent infusion service and prepackaged fluid and electrolytes. Codes represent, oh, I just read that, sorry. The drug that is infused would be reported using the HCPCS code or CPT code 99070. If an infusion lasts 90 minutes, the service is reported as 90765 the first hour. The additional time over 60 minutes would need to be 31 minutes or greater to count for an additional hour, 90766. Okay. The key to billing for hydration, therapeutic infusion, and IV pushes is that only one initial service is billable per encounter. All others must be coded with an add-on code listed as each additional hour or sequential push. So let's look at the example. 3 hours hydration with antiemetic by IV push for 15 minutes. So 96360 equals 1 hour of hydration. 96361 times 2, hydration hour 2 and 3. 96375 is the antimetic, IV push. So that's how that is broken down. Watch the notes carefully as they are a good indicator of what will be billed together and what is bundled. Okay, so there is a lot of information on this slide, so we're going to take it a little slow. Therapeutic, prophylactic, and diagnostic injections and infusions. It's going to exclude chemotherapy and other highly complex drug or highly complex biologic agent administration, 96365 through 96379. The types of drug administration is going to be therapeutic, prophylactic, and diagnostic. Codes are divided based on administration method. It can be subcutaneous, intramuscular, IV push, intra-arterial, and intravenous push. A push takes 15 minutes or less. Over 15 minutes is an infusion. Also report the substance administered. It can be found in your J codes of your HCPCS. Chemotherapy administration. Okay. Again, a lot of information on this slide. Chemotherapy may be provided by several modalities. Coders should read the patient record carefully before coding to ensure that the correct modality is identified. These codes represent only preparation and administration of chemotherapy. If separate E&M services provided, you use an E&M code and you use a modifier 25. A chemical can be administered, injected into a lesion, a vein, tissue, muscle, artery, cavity, and nerve. There's quite a few slides on chemotherapy. Intravenously injected chemicals, 2 methods of delivery of the chemical. An IV push, quickly puts into the vein, is 15 minutes or less. An IV infusion is going to be a longer period of time, which would be 15 minutes or more. Chemotherapy administration codes are covered only when the drug being used is an anti-neoplastic and diagnosis is cancer. Okay, let me read that again. Chemotherapy administration codes are covered only when drug being used is an anti-neoplastic and diagnosis is cancer. Why should a coder be familiar with the coding requirements of third-party payers for chemotherapy? Some third-party payers will not pay for both an IV push and an infusion on the same day. Others will not. Knowing this helps to assure the correct reimbursement. So our next slide on chemotherapy. Codes are often divided on time of infusion injection procedure. For example, 96413, chemotherapy administration, intravenous infusion, up to 1 hour, single or initial substance drug. When multiple drugs are given by different routes of administration, a separate fee will be paid for each route of administration. Some codes include several hours of treatment time, and others specify each hour of treatment time. Unit billing or multiple coding may be necessary to accurately reflect the services that are provided. More on chemotherapy. Oh, I went too far, guys, sorry. Chemotherapy administration. Chemical agent which is the substance. The chemical agent is the substance, and it's reported separately. Special supplies, such as special needles, are reported separately using 99070R Level 2 HCPCS code. Chemotherapy administration. Report any intra-arterial catheter placement, cut down, with a 36640. Intra-arterial route has coverage restrictions for Medicare. For example, coverage is for patients with liver cancer and colon cancer that is metastatic to the liver. Injections with chemotherapy. If the patient is given an additional medication before or after chemotherapy, such as an analgesic or antiemetic, administration of this medicine is reported separately. Report separately any analgesic or antiemetic for vomiting before or after chemotherapy. Report both the administration and the J code, which is the type of medication the J code is. So we're going to talk about photodynamic therapy, 96567 through 96574. Used in addition to bronchoscopy or gastrointestinal codes. Injected agent remains in pre-malignant cells longer than normal cells. After the agent dissipates from normal cells, lesion is exposed to laser light. Agent absorbs the light. Photosynthesizing agent produces oxygen and pre-malignant cells are destroyed. Special dermatological services, 96900 through 96999. Usually specialized procedures provided on consultation basis. If you need a separate EM consultation code, then you will find that in the EM section and use it when it's appropriate. Treatment of skin conditions, acneotherapy with ultraviolet light, photochemotherapy with light-sensitive chemicals and light rays. What common dermatological condition is treated with acneotherapy? Well, it says it in the name. It's acne. Physical medication and rehabilitation. Okay, physical medication and rehabilitation, 97010 through 97799. It's used by physicians and therapists to report services for a variety of treatments. For example, traction, electrical stimulation used to help heal fractures, and therapeutic exercises. Patient training is gait training and functional activities. Our next slide on physical medicine and rehab. Okay, codes are reported on the basis of time or treatment as stated in the code descriptions, which that's really what our first line said. Codes often have time components. For example, 97761 reports prosthetic training per 15 minutes. Codes are divided by type of therapy, for example, physical or occupational. And modalities are divided by supervised or constant attendance. Okay, active wound care. Okay, you guys probably don't know this about me, but I love wound care. I love wounds. Okay, I'm sorry, I went too far on my paper. So the first thing that we're going to talk about, well, let's look at the code range. It's 95797 through 97610. So debridement, non-selective healthy tissue removed along with necrotic tissue, 97602. Okay, removal of non-necrotic tissue without anesthesia is 95797 and 97598. Negative pressure wound therapy is controlled application of subatmospheric pressure to a wound, 97605 and 97606. Each code for ongoing care reported on a per session basis. Okay, active wound care management, 97597 through 97610. This is going to be our last slide on this. Must document debridement was performed, the level of tissue debrided, and the method of the debridement. Document the size and character of the wound before and after debridement, and document a treatment plan and patient education. Direct one-to-one patient contact. So the next thing that we're gonna, the next slide that we're going to do is on osteopathic and chiropractic service. Osteopathic and chiropractic services, 98925 through 98943. Both inpatient and outpatient settings. Physician services bundled into the codes, and codes divided by number of body regions involved. Okay, now we're going to go to something that we're using a lot of right now. Is telephone and online services, 98966 through 98969. And special service procedures and reports, 99000 through 99091. This is a miscellaneous section that includes codes that do not fit into any other sections. This includes postoperative follow-up visits when a patient comes in for a routine post-op E&M visit and is in a global period. 99024 would be the correct code to use if there is no complications or other complaints. This has no reimbursement value because it's part of the global period. It just states, sorry guys, it just states that the patient was there and was seen. Non-face-to-face, non-physician services, 98966 through 98969, report telephone and online E&M services by non-physicians. Handling and conveyance of laboratory specimens, 99000 through 99002. Office visits after posted hours or on locations other than the office, 99053, a 24-hour facility. And Medicare bundles most of the special services procedures. Oops, I'm sorry, went too far. Special services reports and procedures. Supplies and materials are 99070. Hospital mandated on-call services, 99026 and 99027. And medication therapy management services, 99605 through 99607, report pharmacist services in medication management.